Hey guys, welcome to Medifaction. So today, let's learn about the physiology of hypoxia. Hypoxia is a condition in which the body or a region of the body is deprived of adequate oxygen supply at the tissue level. So, to learn more about hypoxia, let's begin. In this video, I'm going to enumerate with an introduction, classification and causes of hypoxia, also the characteristics and the effects of hypoxia, and also treatment for hypoxia. And finally, we will be dealing with the efficiency of oxygen therapy as a treatment for hypoxia. So let's begin. Introduction. Hypoxia is defined as reduced availability of oxygen to the tissues. The term anoxia refers to absence of oxygen. Classification and causes of hypoxia. Four important factors which leads to hypoxia are: number 1, oxygen tension in arterial blood. Number 2, oxygen carrying capacity of the blood. Number 3, velocity of blood flow. Number 4, utilization of oxygen by the cells. On the basis of above factors, hypoxia is classified into four types. Number 1, hypoxic hypoxia. Number 2, anemic hypoxia. Number 3, stagnant hypoxia. Number 4, histotoxic hypoxia. Each type of hypoxia may be acute or chronic. Simultaneously, two or more types of hypoxia may be present. Let's go in detail. Hypoxic hypoxia. Hypoxic hypoxia means decreased oxygen content in blood. It is also called arterial hypoxia. Causes of hypoxic hypoxia. Hypoxic hypoxia is caused by four factors: low oxygen tension in inspired or atmospheric air, which does not provide enough oxygen. Number 2, respiratory disorders associated with decreased pulmonary ventilation, which does not allow intake of enough oxygen. Number 3, respiratory disorders associated with inadequate oxygenation in lungs, which does not allow diffusion of enough oxygen. Number 4, cardiac disorders, in which enough blood is not pumped to transport oxygen. Now let's elaborate these 4 points. Low oxygen tension in inspired air. Oxygen tension in inspired air is reduced in the following conditions: A. High altitude. B. While breathing air in closed space. C. While breathing gas mixture containing low partial pressure of oxygen. Because of these conditions, required quantity of oxygen cannot enter the lungs. Number 2. Respiratory disorders associated with decreased pulmonary ventilation. Pulmonary ventilation decreases in the following conditions: A. Obstruction of respiratory passage as in asthma. B. Nervous and mechanical hindrance to respiratory movements as in poliomyelitis. C. Depression of respiratory centers as in brain tumors. D. Pneumothorax. In these conditions, even though enough oxygen is available in the atmosphere, it cannot reach the lungs. 3. Respiratory disorders associated with inadequate oxygenation of blood in lungs. Inadequate oxygenation of blood in lungs occurs in the following conditions: A. Impaired alveolar diffusion as in emphysema. B. Presence of non-functioning alveoli as in fibrosis. C. filling of alveoli with fluid as in pulmonary edema, pneumonia, pulmonary hemorrhage. D. Collapse of lungs as in bronchiolar obstruction. E. Lack of surfactant. F. Abnormal pleural cavity such as pneumothorax, hydrothorax, hemothorax, and pyothorax. G. Increased venous admixture as in case of bronchiectasis. In this condition, in spite of oxygen availability and entrance of oxygen into the alveoli, it cannot diffuse into the blood. 4. Cardiac disorders. In congestive heart failure, oxygen availability and diffusion are normal, but the blood cannot be pumped out from heart properly. Characteristic features of hypoxic hypoxia. Hypoxic hypoxia is characterized by reduced oxygen tension in arterial blood. All other features remain normal. Moving on to the next type, anemic hypoxia. Anemic hypoxia is the condition characterized by the inability of blood to carry enough amount of oxygen. Here, oxygen availability is normal, but the blood is not able to take up sufficient amount of oxygen due to anemic condition. Causes for anemic hypoxia. Any condition that causes anemia can cause anemic hypoxia. It is caused by the following conditions. 1. Decreased number of RBCs. 2. Decreased hemoglobin content in the blood. 3. Formation of altered hemoglobin. 4. Combination of hemoglobin with gases other than oxygen and carbon dioxide. Decreased number of RBCs. RBCs decreases in conditions like bone marrow diseases, hemorrhage, etc. Decreased hemoglobin content in the blood. Conditions which decrease the RBC count or change the structure, shape, and size of RBC, that is, microcytes, macrocytes, spherocytes, sickle cells, poikilocytes, etc. are the certain size or shapes of the RBCs which can decrease the hemoglobin content in blood. Number 3. Formation of altered hemoglobin. Poisoning of chlorates, nitrates, ferricyanides, etc. causes oxidation of iron into ferric form, and the hemoglobin is known as methemoglobin. Methemoglobin cannot combine with oxygen. Thus, the quantity of hemoglobin available for oxygen transport is decreased. Number 4. Combination of hemoglobin with gases other than oxygen and carbon dioxide. When hemoglobin combines with carbon monoxide, hydrogen sulfide, or nitrous oxide, it loses the capacity to transport oxygen. Characteristic features of anemic hypoxia. Anemic hypoxia is characterized by decreased oxygen carrying capacity of blood. All other features will remain normal. The third type, stagnant hypoxia. Stagnant hypoxia is the hypoxia caused by decreased velocity of blood flow. It is otherwise called hypokinetic hypoxia. Causes for stagnant hypoxia are: stagnant hypoxia occurs mainly due to reduction in velocity of blood flow. Velocity of blood flow decreases in the following conditions. Number 1. Congestive cardiac failure. Number 2. Hemorrhage. Number 3. Surgical shock. Number 4. Vasospasm. Number 5. Thrombosis. Number 6. Embolism. Characteristic features of stagnant hypoxia. Stagnant hypoxia is characterized by decreased velocity of blood flow. All other features will remain normal. The fourth and last type, histotoxic hypoxia. Histotoxic hypoxia is the type of hypoxia produced by the inability of the tissues to utilize oxygen. Causes for histotoxic hypoxia. Histotoxic hypoxia occurs due to cyanide or sulfide poisoning. These poisonous substances destroy the cellular oxidative enzymes and there is complete paralysis of cytochrome oxidase system. So, even if oxygen is supplied, the tissues are not in a position to utilize it. Characteristic features of histotoxic hypoxia. Histotoxic hypoxia is characterized by inability of tissues to utilize oxygen even if it is delivered. All other features remain normal. Effects of hypoxia. Acute and severe hypoxia leads to unconsciousness. If not treated immediately, brain death occurs. Chronic hypoxia produces various symptoms in the body. Effects of hypoxia are of two types. Number one is immediate effect. Number two is delayed effect. Let's talk about immediate effects. Number one, effect on blood. Hypoxia induces secretion of erythropoietin from kidney. Erythropoietin increases the production of red blood cells. This in turn increases the oxygen carrying capacity of blood. Number 2. Effects on cardiovascular system. Initially, due to the reflex stimulation of cardiac and vasomotor centers, there is an increase in rate and force of contraction of heart, cardiac output, and blood pressure. Later, there is reduction in the rate and force of contraction of heart. Cardiac output and blood pressure is also decreased. Number 3. Effects on respiration. Initially, respiratory rate increases due to chemoreceptor reflex. Because of this, large amount of carbon dioxide is washed out, leading to alkalemia. Later, the respiration tends to shallow and periodic. Finally, the rate and force of breathing are reduced to a great extent due to the failure of respiratory centers. Number 4. Effects on digestive system. Hypoxia is associated with loss of appetite, nausea, and vomiting. Mouth becomes dry and there is a feeling of thirst. Number 5. Effects on kidneys. Hypoxia causes increased secretion of erythropoietin from the juxtaglomerular apparatus, and alkaline urine is excreted. 6. Effects on central nervous system. In mild hypoxia, the symptoms are similar to those of alcoholic intoxication. Individual is depressed, apathetic, with general loss of self-control. The person becomes talkative, quarrelsome, ill-tempered, and rude. The person starts shouting, singing, or crying. There is disorientation and loss of discriminative ability and loss of power of judgment. Memory is impaired. Weakness, lack of coordination, and fatigue of muscle are common in hypoxia. If hypoxia is acute and severe, there is a sudden loss of consciousness. If not treated immediately, coma occurs, which leads to death. Delayed effects of hypoxia. Delayed effects appear depending upon the length and severity of the exposure to hypoxia. The person becomes highly irritable and develops the symptoms of mountain sickness such as nausea, vomiting, depression, weakness, and fatigue. Treatment for hypoxia. Oxygen therapy. Best treatment for hypoxia is oxygen therapy, that is, treating the affected person with oxygen. Here you can see how the procedure is done. Pure oxygen or oxygen combined with another gas is administered. Oxygen therapy is carried out by two methods. Number one, by placing the patient's head in a tent containing oxygen. Number two, by allowing the patient to breathe oxygen either from a mask or an intranasal tube. Depending upon the situation, oxygen therapy can be given either under normal atmospheric pressure or under high pressure, that is, hyperbaric oxygen. In normal atmospheric pressure, with normal atmospheric pressure, that is, at 1 atmosphere or 7660 mm mercury, administration of pure oxygen is well tolerated by the patient for long hours. However, after 8 hours or more, lung tissues show fluid effusion and edema. Other tissues are not affected very much because of hemoglobin oxygen buffer system. In high atmospheric pressure, hyperbaric oxygen. Hyperbaric oxygen is the pure oxygen with high atmospheric pressure of 2 or more than 2 atmosphere. Hyperbaric oxygen therapy with 2 to 3 atmosphere is tolerated by the patient for about 5 hours. During this period, the dissolved form of oxygen increases in the arterial blood because the oxygen carrying capacity of hemoglobin is limited. At this level, tissue oxygen tension also increases to about 200 mm mercury. However, tissues tolerate the high partial pressure of oxygen without much adverse effects. But oxygen toxicity depends or develops when pure oxygen is administered for long periods. Efficiency of oxygen therapy in different types of hypoxia. Oxygen therapy is the best treatment for hypoxia, but it is not effective equally in all types of hypoxia. Value of oxygen therapy depends upon the type of hypoxia. In hypoxic hypoxia, the oxygen therapy is 100% useful. In anemic hypoxia, oxygen therapy is moderately effective to about 70%. In stagnant hypoxia, the effectiveness of oxygen therapy is less than 50%. In histotoxic hypoxia, the oxygen therapy is not useful at all. It is because even if oxygen is delivered, the cells cannot utilize oxygen. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.